Resistance training is a mode of exercise that is really available to everybody. So when you think of physical activity, you can think of it in terms of aerobic and anaerobic type training. So aerobic being running, walking, swimming, biking, and then anaerobic is more of your short duration exercise in which resistance training falls into. It's using an external load, whether that be dumbbells, barbells, other implements or household items that you have, and essentially looking to improve muscle cross-sectional area as well as bone density, and allows your body to really withstand the rigors of activities of daily living.
Daughters explained there are a lot of misconceptions when it comes to weightlifting. Some of those misconceptions being that only young people lift weights and people only do weightlifting to bulk up.
That's simply not the case. You can start where you're at, and really the benefits you're looking to get is to develop your strength relative to your body weight, your muscle size currently, and then make progressions as you do that. And so improving muscle cross-sectional area, improving bone density is going to allow you to kind of dictate your function, and structure dictates function so that you can improve those other areas of your life. Activities of daily living are the biggest reason as we age that we want to continue to resistance train. And kind of like I mentioned before, structure dictating function is going to improve those activities of daily living.
Doing weightlifting or resistance training can improve the ability to do cardiovascular exercise along with heart health and function.
As we age, we lose muscle mass, and that's just a normal process with aging. As you get to age 30, every 10 years, you lose about 3 to 5% of your muscle mass. And so it's important to resistance train to maintain that as much as we can.
Daughters explained the American College of Sports Medicine recommends a goal of resistance training 2 to 3 times a week, which works every major muscle group in the body. For your workout, they recommend 2 to 3 sets of 8 to 12 repetitions of those muscle groups. Daughters also stated that's a goal, not where you need to or should start. Knowing where to start can also be tough.
The best places that you can look for your information are reputable, degreed professionals in the field. So if you're looking at strength and conditioning, it's somebody that's going to have some sort of degree in exercise science or a related field. Organizations such as the American College of Sports Medicine, which ACSM, if you're looking it up online, has great information on where to start, how to start, exercises to do. Best practice is to do some sort of pre-exercise questionnaire, health history, and the best option is to talk to your doctor prior to starting exercise. There are a variety of questionnaires, one being the PARQ, which is the Physical Activity Readiness Questionnaire, that will essentially demonstrate if there's any contraindications to exercise. But for the most part, a healthy average male or female can be doing the same things. You're going to base your exercises from the same exercises and modifications. Our heart rates are all the same, and as we age, that changes as well too. And so you can base your intensities off of your heart rate for exercise. And so men and women really should be doing resistance training, doing the same exercises, and then really partaking in the same progression programs for those resistance training goals. Injuries are a big part of everyday life. It's safe to say that resistance training, if you look at like all other sports, if you look at all other activities, the chance of injury during resistance training that's properly supervised, that is taken seriously and done with the right form and technique, the chance of injury is very, very, very low. So things we should look for really come in the form of like overtraining. And that's part of one of those misconceptions is we think we have to exercise every day at a high intensity to see any of the benefits. And really it comes down to the ebbs and flows of high intensity exercise with rest days. And so that's where the 2 to 3 days is a great goal, because you can set that up in a weekly plan where you exercise, you rest, you exercise, you rest. And so I think the modification should be based off if you are fatigued, you rest. If you have acute injuries, whether that's upper body or lower body, you make your modifications based off of what that injury is. I would say to somebody that's nervous about starting to start where you're at. You do not have to start from zero and then work out or exercise 7 days a week. The guidelines are there to be a first step or goal, meaning that you're going to start, maybe it's 1 day a week, and then you're working to the 2 to 3 days per week of resistance training. The main goal is to do something, and doing something is better than nothing. So one of the misconceptions that we talked about was the equipment that you sometimes need for resistance training, and it's often thought that you need expensive equipment, you need barbells and weight plates and racks that take up a lot of space. For a lot of general population and as we age, those things are still a good item to use, and if you have a gym available, if you're working with somebody that has that available, it is still good to use, but you can get a lot done with very simple tools, whether you're doing that from home or you're doing it in really the ease of any location that you're trying to work out. And so some of those implements are dumbbells. They're very user-friendly. You can do a lot of different movements with those dumbbells. They're easily accessible. They're not too expensive. You can get them pretty much off of any equipment website. A couple other household items that you could use would be things like a backpack that you can fill up, and I know it seems trivial, but you can put a load that weighs as much as 25 to 30 pounds if you have books or other items, canned goods that you can fill your backpack with. You can wear it on your back and do lower body movements.
Daughter shows 5 different exercises that work all the major muscle groups one can do with dumbbells or any other household items which could take the place of a dumbbell. The first exercise is a squat. When doing this exercise, Daughter says to think of sitting in a chair, then standing up from the sitting position.
So the first exercise I'm going to show is a dumbbell or kettlebell. You could use this with all of those implements. It's going to be a kettlebell goblet or dumbbell goblet squat. And essentially we're holding it like we would hold a bowl in front of our chest, and we're wanting to keep this as close to the chest as possible. With this movement, we're going to squat. This will be a bilateral squat, so a normal squat as well. We're going to keep both feet pointed straight ahead or slightly outwards, and then we're going to sit back like we're sitting into a chair. Main things here, you're thinking about keeping your knees out, keeping your core braced, keeping your back nice and straight. And so a movement would look similar to this, where we're sitting all the way down and then standing all the way back up. Some modifications for this would be the load that you're using. So you can either dump the load and go to more of a body weight squat where you're not using any load, you're just using gravity, which is a great place to start, and you're going to get benefit from that. And then you can increase the load as well.
A question often asked is how deep a squat should be. According to Daughters, you should exercise with a wide range of motion, but to start where you are comfortable and slowly work for a deeper range of motion.
And as long as you're sitting back into your heels and you're sitting with a rigid and upright torso, then you can start working down through those ranges of motion and get deeper as you progress through that movement.
Another lower body movement is a single leg variation.
For these movements, you use a box height. Ultimately, that gets your leg to a 90 degrees. So I'm using a 12-inch box here. This would be a little bit short for me, but talking about start where you're at, start with a height that you're comfortable with. And so the main component here is you want your knee in line with your little toes, and you want a little bit of forward lean of your shin. And you're keeping your knee in line with those little toes so that it doesn't dive in, and you're keeping it so that it doesn't go outward. And then from here, you're keeping your torso up. You're going to lean all that weight forward to the front leg, and then you're going to drive up, stand tall. And then you would reverse that movement, go straight down, control, and then you could reset for the number of repetitions that you would want. You can load this up with a dumbbell as well. You can hold in the goblet position just like we would for a squat. That keeps it simple across movements. Lean that body weight forward, stand tall, step down.
The next movement is called a hip hinge, and this movement is tied to an RDL or Romanian deadlift.
We can do this with kettlebells and dumbbells alike. We can do this without any weight to get the movement down. Essentially what we're doing is we're trying to hinge, flex, and extend at the hip without any other movement of any other joint in the body. What this does is it helps train our glutes and our trunk. And so what we're trying to do is keep our feet shoulder width apart, pointed straight ahead, and then we're hinging right at the hip, keeping our back nice and flat. And so essentially we're only dipping forward from the flexion at the hip. Okay, depth here is going to be dependent on, again, your range of motion, typically within the hamstrings, and then you're coming all the way back up to reset that motion. So with a kettlebell and a dumbbell, you could use this the same way, but you're holding that implement out in front because you want it to pull you forward. You want to resist that movement pulling you forward. That's where the work of the muscle comes from, is from that weight being out in front of the body. Feet shoulder width apart. You're going to pull your shoulders directly backwards. You're going to brace your core, and then from here you're going to hinge and let that kettlebell or dumbbell go straight to the ground. You get to that bottom range of motion, and then you're squeezing the glutes and pulling through the hamstrings to get tall. A front view would be with the feet straight ahead, about shoulder width apart, hinging at the hip, and then standing tall.
Movement 3 focuses on pressing and pulling your upper body horizontally, and the exercises which can help with this are a push-up and a row.
Push-ups can be done in a variety of ways. You don't have to always do them from the floor to see the benefit in your upper body musculature from a push-up. And so you can use a wall, you could use a chair or a couch, you could use boxes if you have something available. But ultimately what you're trying to do is elevate your upper body from the ground to make that easier. And again, you would start where you can get those 8 to 12 repetitions, and then you would progress to either lower implements, lower boxes, maybe from the ground and the knees, and ultimately, if you can, a full push-up from the floor. So with a push-up, if you're using an implement that elevates you from the ground, so such as these boxes, you're going to want to get your hands at a width that lets your forearms be vertical to the ground, meaning if you're too tight, your forearms are not vertical, and if you're too wide, your forearms are not vertical. So for me on this box, it's about the edge of the box. And when I go down, I'm thinking about keeping my core and my glutes braced so that I keep a straight line. I'm keeping my heels off the ground so I can move my body freely. I'm keeping my head and neck neutral. And I'm going all the way down through a full range of motion and then all the way back up.
The next exercise is a row.
We're going to pull something. We could use an implement, again, such as a dumbbell or a kettlebell or those household items, and we're going to do a row. And so with this, we're going to do a single arm row with a dumbbell. We just talked about the RDL, and we're going to tie in these movements, and these functional movements are going to help kind of progress through with learning one helps aid in another. And so with this row, we're actually going to get into the position that we just learned with the RDL, right? So we have a braced core, our glutes and hamstrings are working, and that is going to set us up for the position that we'll be in with this row. Okay, it's essentially the middle portion of your RDL. From here, we're going to let that dumbbell or the implement we're using hang. We're keeping our back in a nice flat position, and then our shoulder blade is going to pull through a full range of motion. We're going from the ground, pulling all the way up, pulling that shoulder blade back. We're going to control it on the way down, nice and slow, and then pull that shoulder blade back as we do those reps. Again, you're going to do 8 to 12 repetitions, and then you can adjust load based on how that load feels at that 8 to 12 repetitions.
The fourth movement is an overhead or vertical press and pull. These exercises help with the daily movements of daily living, such as grabbing something off the shelf or pulling yourself up from something.
The two motions I'm going to show here are an overhead press, so a standard military or dumbbell shoulder press, and then we're going to show a pull down with this movement pattern. For this, we're going to use 2 dumbbells, and again, you could use a variety of implements for this. You can do this with 2 arms or with just 1, and then alternate between the 2. But from here, what we're doing is we're setting, again, a good base, so feet about shoulder width apart. Dumbbells or the implement that you're using are going to sit right on the front of your delt, or right on the front of that shoulder muscle, and then from here, you're going to press straight overhead until you reach full extension, and then control on the way back down. And again, you would do this for your 8 to 12 repetitions, controlling through that full range of motion. Some of these overhead motions are hard if you have shoulder impingements or if you have shoulder injuries, which a lot of people do have shoulder injuries. So some of these may be better done in a neutral position and with one arm, in which you're holding it very neutral to the body, meaning your elbow is not out and it's not going up from the outward position. You're keeping it neutral and in front of the body.
Another exercise within this movement is a pull down. Oftentimes, people think of pull downs like a pull up or chin up, but with this exercise, it is a pull down with a band.
So within movement number 4, we're talking about overhead pressing and pulling. And when you think of an overhead pull, A lot of people will think about like pull-ups, chin-ups, but not everybody can do a pull-up or chin-up or has access to a pull-up or chin-up bar. And so I'm going to show a variation today that's a good alternative to pull-ups, or if you have an injury limitation or you're looking to just start somewhere with a pulling mechanism from a vertical style. So I have a band set up here. It's set up on this rack right in the middle. Now you could use a door where you loop the band around the top of the door. Make sure that you close the door fully so that it is resting against that and it's within the frame so that you're not going to pull the band at you or you're not going to go through the frame of the door. And so you can do a variety of different pulls with this. The one I'm going to show is a half kneeling single arm pull where I'm going to kneel on the ground with the opposite knee that I'm pulling with is going to be up in front of me. And so I'm pulling with my right hand right now, which means my left knee is up and my foot is placed firmly on the floor. Again, I want to think about like bracing the core and having a nice flat back. So I'm keeping the torso up. I'm keeping my glutes underneath me. And then I'm going to reach up on the band to a height where, again, I can pull through a full range of motion. So that key is going through a full range of motion. And I'm going to pull straight down to the level of the shoulder and then control on the way back up. And the easy thing about bands is if that was too hard, I could just slide my hand up and down the band if it was too hard, or if it's too easy, I can make it harder, more challenging, and then I'm pulling through a full range of motion. And then I could do the other side.
The fifth and final movement focuses on the trunk and core.
Essentially, there's two different movements that we use every day. We rotate through our core and our trunk for movement, for walking, gait. If we're walking somewhere and turning around, we're rotating. But then with a lot of those movements, we're actually doing what's called an anti-rotation, or we need to be able to brace our core. Bracing our core is really going to tie in being able to keep form and technique for the squat, for the RDL, for the row, for all the movements that we perform with resistance training. Bracing of the core is really important.
When bracing your core, ensure your feet are hip-width apart, feet are straight ahead with a slight bend in the knee. Then think of pulling your belly button in as if you have a string attached from the back, and pull your belly button in as tight as you can, which helps brace your core.
So the exercise that I'm going to show for a rotation, we're actually going to use our milk jug here. So if you're using a household item for your resistance training, is we're going to show a rotational or a diagonal rotation. And so again, you want to give yourself a good base, feet about shoulder width apart, feet are straight ahead. You're going to have a little bit of bend in your knees. You're going to brace at your core, and then you're going to load from the outside hip, and then you're going to go up and across. And you're going to allow your torso to rotate without your lower body rotating and following suit. So you want to keep your lower body just like a squat, knees out, relatively neutral, and you're going to load and rotate. Load and rotate. And you would do that again for your 8 to 12 reps. You could also do this from the other side where you load the outside hip here, and then you rotate up and across. And you would do that again for 8 to 12 reps. For an anti-rotation, you can do a variety of different bracing exercises. So it'd be as easy as sitting in the same position that we just did the rotations with, and then holding an object out in front and just bracing the core. So your load is pulling you forward, you're trying to resist that movement. You could have a partner help you and try to move you side to side, up or down, and that would help you resist that movement.